Okay, everybody. So I'm going to jump on here. Let me just get everything set up here. So as a background, I'm a spine surgeon in Dallas, Texas. I do everything from the skull all the way down into the pelvis. I kind of jump onto these live sessions on social media just to answer questions for patients. I can't really give any medical advice, but I like to go over different topics, like to clarify things in terms of spine surgery, spine care, spine terminology. So look, in general, there's a couple different ways to look at the spine. And let me do some basic anatomy first, and then we'll kind of go from there in terms of looking at the spine. So in general, the spine is made up of bones, disc, and joints, just like the leg, just like the arm. And here's how it works. It goes bone, disc, all the way down. Behind each of these disc spaces and kind of in between each column of the bone is these nerve roots. And these nerve roots are what get pinched. The nerve roots are what kind of shoot down, causing radiculopathy, sciatica, things like that. When you get a disc herniation, that's what can hit this nerve and kind of shoot down things, and different nerves go to different areas. Again, to kind of reset, I'm a spine surgeon in Dallas, Texas. I don't want this to be a marketing thing or anything like that. I kind of just jump on here for maybe 30 minutes at a time, every couple of weeks or so. It used to be a lot more, but life gets busy. And I just go over different concepts. So the main concept I want to go over tonight, and the questions when they come in, I'll try to get to them. Again, there's usually a couple hundred, sometimes a couple thousand people in here, so I won't get to all your questions. You can always direct message me, and I can get to it that way also, but can't give advice over social media. But again, the big concept I want to go over today is spinal stenosis. And what is spinal stenosis, and what does that mean? What do you have to do about it? So look, I'm going to kind of make this short and sweet. Spinal stenosis, spine is the spine. This is going to be the neck, thoracic spine, or lumbar spine. This is a lumbar spine model. Spinal stenosis is when you get tightening, stenosis, of the nerve roots or the thecal sac or the spinal cord. So if this is the model of the spine, looking down the tunnel of the spine, looking down this tunnel, in general, 3 things can cause spinal stenosis. Now there's a bigger list. I'm not going to go over infection, tumors, gunshot wounds, all those things can cause tightness. But in general, if you're watching here tonight, and you have spinal stenosis, it's extraordinarily likely from disc herniations, like a disc material protruding up, squeezing that area. That's a very, very, very common thing. You have these joints in the back, just like in this disc replacement here, which I'll talk about in just a little bit. If you have these joints moving in the back, just like you get an arthritic stuff, callus formation, of course, on your hands or on your feet, you can get callus formation. That's what can happen in these joints, arthritis, callus. It just builds up extra tissue that could grow into the canal, causing spinal stenosis, squeezing all of those nerves. That's another major cause. And the third, I said there were 3 major causes of spinal stenosis. And this one's kind of my favorite, and I'll tell you why in a little bit. If you see this term on your x-ray or MRI, it's called spondylolisthesis. And that's when one bone slides forward on the other. That could be from 2 things. Usually it's from joint arthritis here, or it could be from a fracture in the pars. In about 90% of people, it's at L5-S1. In 10%, it's actually 11. It's at L4, L5, and that's the spondylolisthesis from a pars fracture. And that's another thing that squeezes down and squeezes the nerves there. So if you have spinal stenosis, do you need to do anything about it? Well, not necessarily. It's all about just because you have a radiographic finding, and this is, I have a lot of patients on here listening in now. Just because you have a radiographic finding doesn't mean you need to do anything about it. It's all about treating the symptoms, and that's why I use physical therapy, injections, anti-inflammatories, narcotics, neuromodular agents, things like that, to try to lessen the pain and avoid surgery. Surgery is great when you do all these things, when you fail conservative treatment options. If you have weakness, 3 out of 5, profound things like that, then of course surgery is a great option. I'm not denying surgery, but I'd love to earn your trust, your parents' trust, your family's trust, uncle's trust, sister's trust, whatever, conservatively. So let's go over some of the questions that are coming in right now, and I see one of them, and we'll kind of get to spinal stenosis. Again, I appreciate all the likes and shares that are coming through. That really helps promote this to other people that are having similar issues, such as you, that are having these issues. That helps get it up kind of on their thing. Bethany, spine rep here, good to see you. From Hitched to Jaw Jr. Did all that before surgery, now 4 months post-op, glad I did it. That's another great comment. From Maddie Wise, how do you stop the pain and numbness? From Marty, the first thing you got to do is diagnose what's causing the pain and numbness. From Athens, we can hear you now. Great. Yep, I was having some mic issues earlier. Sorry about that. Trying to be a little too fancy here, and I should just do it old school sometimes. From Candy, how do I relieve the pain from sciatica? The first way to do that is to diagnose what's causing the pain. Is it coming from the muscle around your butt squeezing the nerve? Is it coming from peripheral neuropathy, or is it coming from a disc herniation or a pinched nerve? So you got to get that diagnosis first. That's an X-ray, an MRI, and likely a exam of talking to someone. Andy, fusion at L5S1 saved me. That's great, Andy. Thanks for reaching out. Good talking to you. Trying to get some of these questions. I appreciate the videos. Now I can better my doctor. I don't know what that means. I must have misread something. What do you think about the ring dinger? Remind me what the ring dinger is. Is that a wrestling move? I think. I'm not exactly sure what that is, but I probably don't like it. Proper stretching every day helped me. From Paul, that's great. I had an annular tear and leaked all my disc. From Andy. Yep. Let's talk about annular tears. So if this is the disc right here, the outside ring is the annulus. It's almost like a toothpaste container, and that's the strong thing outside. Well, if you get a rupture or cut of that toothpaste, that can squeeze out the toothpaste. That's the disc material, and that hits this nerve root, causes the shooting down pain, the pinched nerve, or the numbness or tingling, or even the weakness. And I usually tell patients the reason I like using toothpaste as the analogy is because once it comes out, it doesn't go back in. Just like toothpaste. You can't put it back in. Now your body will eat it away, take it away. I appreciate all the likes coming through. That helps promote this to other people watching, other people going through the same issues, the likes, the shares, the follows. From Shorty, thanks for the follow. Donna, thanks for the like. I appreciate that going through. From GRIF, what is your opinion on NAC or NAD for nerve or nerve inflammation? Is there anything outside of surgery that can happen? Tell me what you mean by those acronyms. I just don't want to misunderstand, and then I can answer your question better, Griff. I appreciate it. Does the nerves get used to a spine stimulator? Do the nerves get used to a spine stimulator? That's probably that means. Spine stimulators are good for when you have a condition that is not amenable to surgery or something where you can't necessarily find the surgical alternative to fix it. Let me tell you about that. So a spinal cord stimulator usually is replaced by pain management doctors. Some spine surgeons might do it. It kind of depends on if you live in a more rural area or not. So I'm trying to fix the spine model. It's breaking on me. But the spinal cord stimulators are something I don't necessarily order or anything like that. But sometimes I have the pain management doctors evaluate the patient to see if they'd be a candidate for it. Again, if someone has shooting down pain, numbness or tingling, and there's like a disc herniation or there's spinal stenosis, that's a great indication for treating that issue, not with the spinal cord stimulator. A spinal cord stimulator is not something I routinely order or have patients get. I kind of send that to pain management doctors, and if they think a patient is a candidate for it, you can. Alan Martin, I have double sciatica. Maybe that means left and right side. Someone asked me if it's a slow work day. It's 9:30 at night on a Saturday, so it's not, or it's a very slow work day because I'm not working at all. Okay, from Griff, he answered it's N-acetylcysteine or nicotinamide adenyl dinucleotide. Gosh, I can't believe I was even able to say that half right. I don't know too much about those. Those are words that I recognize from college and organic chemistry, so I don't exactly know what those are. I apologize. So I don't know if those are effective or not. Maybe if they're used in trade names, I can do that. I see a couple. How can you address an annular tear and how to address it? Well, that's a great question. So let's talk about back pain in general. And again, I appreciate the likes and shares going through. If we can get these up to 5,000, that'd be great. Keep liking away. I'll keep talking away. So back pain in general is caused from three things. Now, again, there's more than three things that can be causing it. But in general, the back pain is from three things. And let's talk about that. One is from a rupture of this annulus. That hurts. Your body releases inflammatory markers, cytokines, and that just hurts. It's trying to tell your body to stop doing something. It's a protective evolutionary mechanism. Your body hurts. That's one. Two, you've totally lost your disc space. So now, you look at this disc replacement model, and I'll get to that in a little bit. You're bone on bone. So this bone is grinding on bone here. You've lost the disc here, and so this bone is grinding on bone here. Another source of back pain. You could also get back pain from poor spinal alignment. And that could be done either the medical words iatrogenically. So maybe you had a fusion 30 years ago, and that was before we had the technology we have now to where we curve the spine up. We promote something called lordosis. There's a mosquito in here. something called lordosis. Let me show you some of these technology things we use these days. So, for instance, look at this big fatty cage here. So this is an A-lift cage, and if you can tell, it's kind of this wedge shape. It almost looks like a doorstop, and it's a big cage. Here's my thumb. Thumb's kind of big, but I'm trying to give you perspective. Okay, here's a writing pin. So you can see that's a big cage. We use these now more than ever that have this curve, this wedge shape, to help restore lordosis in the spine. That's a big deal. Spinal, pelvic parameters, spinal surgery, all those things to curve the spine like that, to put your shoulders over your hips, reduces the amount of back pain you're having. That's why when you see old people in general who've lost a lot of their disc spaces, or they have osteoporotic fractures that have healed kind of flat like that, their spine, if it should be like this, it's now curved like that. And so what do? They bend their knees, so they flex their knees, they flex their hips, trying to pull everything back. Well, that gives you flexing all these muscles. That gives you back pain. You're flexing all these muscles all day. It'd be the same thing if I carried 2 milk jugs right now. I'm not that strong of a guy, but I could probably do it for a good 10 minutes and be okay. But after that time period, then your muscles are going to start fatiguing. They'll start soring. So that's a major cause of back pain, is loss of this lordosis. And there's a whole field of spine surgery. We talk about realignment using these high-tech cages. And that's kind of the whole deal these days. That's why we're using things that are so different than when your parents or grandparents had spine surgery years ago. Again, appreciate all the likes coming through. That kind of helps promote this. I'm going to talk about chiropractors next. Okay, I got this mosquito in here. I'm in Texas. We got a lot of rain, so now we got a lot of mosquitoes. So look, here's some of the newer technologies we're using. And these are cool. You see how they're like imprinted? Almost looks like they're like spray painted with bone. I'm trying to get it into a nice focus place. So these are just fancy things. Back in the day, we used to use cadaver bone. We used to shove cadaver bone in there, and it was fine. It was fine. We didn't have curvature for it. We didn't measure it out as well. And we had to pack it with certain bone grafts. Now we put in these really high-tech cages, and there's nice scaffolding for bone, so you get higher fusion rates. You hear about people that, and this is still common today, their screws came loose. Well, their screws became loose because they didn't fuse. The screws only became loose either because it's at the top of the construct or it just never fused. So now we have better fusion. We have better biologics. I see some spine reps in here. That's kind of the whole deal. If you don't get a fusion, eventually those screws might come loose. So if you got to do it once, you might as well do it right the first time. And fusion, getting those bones to heal, that's a very, very big deal. Okay, let me go to a couple other topics. Can I talk about severe stenosis? So you can get stenosis of 2 things. You can get it of the nerve root here that causes the shooting down pain, or you can get it centrally that could cause neurogenic claudication. Neurogenic claudication is the presentation where you have to really lean forward to relieve your pain. Your legs, both of them, get really heavy after a certain period of time, maybe just a couple minutes, and you have shooting down pain. That's just from all the nerves being so squeezed in the back there. You have to sit down. When you go to a grocery store, you have to lean over a shopping cart. It's also called the shopping cart sign. Now, this could also be vascular claudication. That's something that an exam can help differentiate, whether you have blood clots in the leg preventing that, or it's neurogenic claudication, and that's a great way to do it. All right, let me get to some questions here. Oh, chiropractors, yes. Okay, appreciate everyone hitting the likes and shares, because I'm going to talk about chiropractors now. I know it's a very hot topic, and a lot of people want to know. So look, my first disclosure on chiropractors, and again, my background is I'm a spine surgeon here in Dallas, Texas. I jump onto these lives maybe once a week, maybe once a month. It kind of just depends on what's going on. I talk about different spine topics. I'm in Dallas, Texas. You can direct message me and give you more information for telemeds, but I don't want this to be about that. I just want to kind of be a little educational here for quite a bit. Again, appreciate the likes and follows coming through. I see there's a lot coming through. Okay, so for chiropractic providers, I'm fortunate to work in Dallas, and I know about 3 or 4 of them personally well. I didn't know them before I became a surgeon, but from a professional standpoint, I've gotten to know them. I've gotten to work with them, and they're fantastic. They're not the people that are putting up TikTok videos about how many pops can I get, and they're not taking your like legitimately 4-year-old son or daughter and popping their back, or your 5-month-old child and saying, oh, they have reflux, I'm going to pop your 5-month-old child's back. That is criminal, in my opinion. Criminal to be doing chiropractic manipulation to infants and newborns, but that's a different topic. Apart from those people, I am totally pro chiropractic manipulation, not the popping, but kind of stretching, deep tissue massage. anything non-operative that they can offer, I'm usually in favor for, especially for the lumbar spine. Now, the cervical spine, I sometimes have different thoughts. I'm not a big fan of traction. Right there at the table with their hands, I'm okay with that. Y strap, I have a video on YouTube about this. The Y traction that kind of like rips your head off, ridiculous. Don't do that. The slow, then popping of the neck, also totally ridiculous. Don't do that. I know several people have had strokes from that. Totally ridiculous. But kind of gentle manipulation, deep tissue massage, cupping, things like that, I'm okay with that from a chiropractic standpoint because, look, I'm an expert on surgical indications. I'm an expert on doing spine surgery. I'm pretty darn good at non-operative stuff, but there's other people who specialize in non-operative stuff, and we got to use them. They're not going away. I might as well find alliances and partnerships and learn from them about some of the things that they offer and get to know it better. So I support chiropractic doctors, especially for the lumbar spine. I support them as a way to avoid surgery. But I don't think you should just see them and not your spine surgeon. It's something where I see a lot of patients and they've maybe spent thousands of cash dollars, because they don't cover by insurance, seeing their chiropractic doctor doing these crazy like red light therapy or just like crazy things that don't make any sense. And then they come see the spine surgeon. Let the spine surgeon be the quarterback. Let the spine surgeon direct the non-operative care. Let the spine surgeon recommend a chiropractic doctor. If they're a good spine surgeon, they should be able to give you a couple names of chiropractic doctors they work with. And if they don't, then that's, a little suspect. Like if they're experienced, if they've been around, they should know a couple chiropractic doctors who are good. So I like to be the quarterback of the care. I like to start with me. I'll order the MRI. I'll send you to physical therapy. You can go to whichever one you want. I'm not biased on which one you go to. I can direct you to chiropractic. I can direct you to pain management. I don't like being the last stop. I like kind of being that first or maybe second or maybe third stop. But being the last stop, well, by that time, you wasted a lot of time and money. And maybe the shots you got were kind of this shotgun thing where none of them stuck. I like to kind of do sniper rifle, like hit specific nerves, not just try to blast the whole thing and do all these injections and ablations. We like to be very specific about it. So Donna, going to your question I just asked, how do I feel about pain management doctors? Kind of the same thing. If they're taking your money and doing all these crazy things, I don't like that. But if it's like a specific non-operative thing that the spine surgeon's ordering, that's definitely a thing. Another hot topic I have about pain management doctors is they shouldn't be doing spine surgery. And that shouldn't even be a controversy. There shouldn't be like a hot take on having spine surgery should be done by spine surgeons. And if you're like, do pain doctors do spine surgery? Yes, like way all the time. And it's crazy. They'll put in these Coflex devices, these spacers, and they'll say, oh, this is better than getting a fusion. I'm just putting this Coflex spacer in. That's ridiculous. I'm not 1,000% against Coflexes. I'm 1,000% against pain management doctors putting in Coflexes. But if a spine surgeon has that extraordinarily narrow indication for a Coflex to put in, I'm okay with that. I would probably never do it, but I could see some people doing it. All right, with that, I really appreciate everyone. Appreciate the likes, appreciate the follows. I'm going to jump to some questions. I'm going to try to go rapid fire, and I'll get to that. So let me kind of jump to this one platform, and then I'll jump up to this next one. So how do I feel about thoracic chiropractic? Mixed. That's where your spinal cord is, so not a huge fan of popping or anything like that. Can you talk about annular tears? I did earlier for you. Rewind the video after this loads. You can hear more about that. My chiropractor can't help with spinal stenosis, can they? Not really. They can't reverse the spinal stenosis. They can help treat some of the symptoms associated with spinal stenosis. How do you correct 45% scoliosis? You might mean 45 degrees, and you don't have to fix it. It kind of depends on your age, what's it causing you, and all that stuff. Do I work with veteran affairs? I used to work in the VA hospital and training. I see a certain type of TRICARE. I don't know which type. It's one of the three, but not. So I don't know. I take one of the TRICARE, maybe TRICARE for life, but you have to reach out to my office. I'm not sure. All right, now I get to hear. Can you not walk after an SI joint fusion? You can definitely walk after an SI joint fusion. I used to do SI joint fusions. Now I have one of my partners in our group named Dr. AJ Rush. He does all my SI joint fusions. I consider him one of the experts on it, but he lets them walk that day, partial weight bearing or full weight bearing. If you have SI joint issues, direct message me. I can connect you with our office to see Dr. Rush about that. Is sciatica without back pain common? Yeah, I don't know the exact percentage, but it's not uncommon, and that's great. Actually, that's like my favorite thing I see. Let me kind of go over that, what I just said. So back pain sucks because there's like 20 things that can cause the back pain. Shooting down pain is great. because that's likely 1, maybe 2 pinched nerves causing a shooting down pain. That's great. That's an easy thing to fix because it's an easy thing to diagnose. So when a patient says, oh, I don't have back pain, I just have shooting down leg pain, oh, I love it, because that's like minimally invasive stuff, injection stuff, physical therapy stuff. And then if you do surgery, super high success rates because I'm just targeting that one thing. I have a lot of patients I operate on, and they say, man, my leg pain and numbness felt better that day. That's great. I still have back pain, and like, I'll come back to that. They're like, I still have back pain, but my leg pain is better immediately. And I love that. Now, the reason their back pain might still be there is because it depends what surgery I did. I do a lot of laminectomies, a lot of microdiscectomies, a lot of decompressions. And so I'm like, look, our goal is not to fix the back pain with those, because the back pain could be the bone on bone. The back pain could be the instability. I'm just trying to fix the leg pain and the shooting down pain. Fixing the back pain with the fusion, a little bit of a different argument. We can kind of talk about that in a little different thing. From KYN, and then hard name to say, do I have a surgical team? Yep, I have a PA. She's great. She's on maternity leave. If she is watching from home, hello to my favorite PA I've ever had. And then my other team, you have a scrub tech, you have an anesthesiologist. I'm really fortunate in Dallas. It's kind of weird. You guys probably don't know this, but most places you go to, your surgeon doesn't pick the anesthesiologist. The hospital does. They just show up, and whatever anesthesiologist or CRNA is there, that's who you get. And that's crazy. Like, that's how it was in training, because you're at academic hospitals and I didn't think anything of it. But now that I'm out practicing, it's kind of crazy that you could just show up and the hospital picks your anesthesiologist for you. What's that about? That shouldn't be standard. We're just so used to it, we don't think anything of it. In Dallas, I think probably other markets have it, I'm just not sure. There's a lot of places, including every place I go to, that's called an open anesthesia system, where I don't bring my own, like I book it with my own anesthesiology group that I'm friends with. I go to their kids' birthday parties. And so really it's the same, essentially 3, now 4 anesthesiologists in that group. And it's great. They're all MD, not CRNA. I love CRNAs. They're great. Nothing against that aspect at all. But I have the same MD anesthesiologists. They know me. They know my patients. They know my family. And like, we can just focus on the patient. They know the things I'm going to want intraoperatively. They know what medications I like to give in the preoperative holding area. They're not reading the list being like, oh, this is a weird one, let me go find it. So that's just one of the nice things about certain spine surgeons, is like you pick your own anesthesia team. And that sounds crazy. You might be thinking, oh, why do you have that? That's normal. Dan's asking why I'm wearing a scrub hat. Well, Dan, it's 9:45 at night. I just went to the pool with my kids and showered and didn't want to, I also have male pattern baldness, so putting a scrub cap on prevents me from having to worry about any of those things. It's also like, why am I in scrubs? Again, dude, it's 9:45 at night. I was in a t-shirt right here when I came down, but I'm not going to get a lot of viewers wearing a t-shirt. So, of course, I'm not actually in surgery right now at my house. So, yeah, it's from a thing just like that. Where do I work? Dallas, Texas. Same city I was born and raised in. That's a weird question I saw. How can open heart surgery mess with the spine? It's kind of a complicated question. You can get really physiological, but essentially you can get little micro blood clots in the nerves that go to the spine, or in the disc spaces, or maybe just kind of other things like that. Okay, answer questions quick fire. You're right, Wade. Sorry, I promised that. Let me get back to that. Is there any treatment for scoliosis, 38-degree curve, other than surgery? No. Once it curves, it curves. I go to Cleveland Clinic. That's great. That's a good place. They have a great fellowship, actually. Should surgery for spinal stenosis be a last resort? Not necessarily. I mean, try the non-operative stuff first. But I'd say, I'm making this number up, maybe 60 or 70% of the spinal stenosis surgeries I do are outpatient laminectomies. So, like, I don't know if that should be last resort. I don't want that to be the first resort necessarily, but if you fail the non-operative stuff, it's limiting your life. If it's a small incision, if you go home that day, super low infection rate, super low revision rate, sometimes I say just do that. Now, we're talking about rods and screws. That's a different argument, but most of the time you can just fix that. How to fix foot drop? You first have to diagnose what causes the foot drop, and you can reverse it there. It's usually L5. I'm a surgical tech. Teams are very important in California. Yep, I agree. My cervical fusion failed. Screws are pulling out before revision surgery. Bone injections help. Bone injections help. I don't know what that means. Maybe you have osteoporosis and you're getting bone stimulation medications. But if it's pulling out, this is like an example of an ACDF. Here's an ACDF. Here's the plate. I'm not going to advertise this company. This is my favorite plate of all time, though. I have no interest financially at this plate or anything like that, but it's the best plate. It's actually a Dallas-based company. This is an ACDF. If you don't get diffused through here, this plate can pull out just because your body hasn't healed. All right, you have to close, Dr. Bros, that you say after a consult. I don't know what that means. Do you like the granite screw for SI fusion? Oh, that's a great question. Great question. I don't know if I have one here. I should get one. I love the granite screw for SI fusion. My recommendation is make sure a spine surgeon is doing your SI fusion, not a pain doctor. Treatment for spinal cord stimulators. Linda, I already went over that. I apologize. That's a long answer. From Pete, can I send you my MRI to review? Yes, but I also need x-rays. If I just have your MRI, I feel, I'm going to be taking your money without giving you the full answer. I need your x-rays also as long. So go to your other surgery you saw, get the x-rays on a disc and send me those x-rays also, because x-rays and MRI is the number one thing. And then if you go onto my website, again, I don't want this to be an ad, so I'm just going to answer your question and move on. If you go to my website, donnellyspine.com, in the top right, I have a way. It talks about consults, telemedicine, tourist medicine, all that stuff. Top right, just click there. You'll see it. Donnelly Spine, that's my last name, and then spine.com. All right, let's move back to that. Ortho versus neuro for back surgery. I'm super biased. The ortho doctors are all smarter and more handsome, so I'd recommend the ortho doctors. Can celiac disease cause back pain? Yes, it can, but I'm not an expert on celiac disease. What is your take on RFA ablations? RFAs are great for back pain, not shooting down pain, but for back pain. From Illegally Blonde, I had a cage and plate put in my neck and my throat. I'm in a lot of pain. Oh, sorry to hear that. ACDFs, cage and plates, they do fantastic. From Fusions, if you need it. What was that, a NuVasive plate? No, it was a Dallas-based company, Evolution Spine. So good company. I just like a lot. I try to use a lot of Dallas products and Texas products. It's kind of I'm from Dallas. I'm a Texan through and through. NuVasive's great, but why am I sending all my business to California when we have a lot of great companies right here in my backyard, and those great companies employ great people right here in my backyard? So I'm half joking. I use Globus, NuVasive, the big companies, but if there's an opportunity to use a Texas-based company if it's got good stuff, a Dallas-based company that's got good stuff, I like to try to, support my local Dallas community. So a lot of the stuff's all the same. Like a screw is a screw. At the end of the day, it's all about the implants that go in it and all that stuff. Here's a pedicle screw. This is a really cruddy one. It's an old one. I really need to get a better pedicle screw to show off, but fortunately I don't have to take out too many things that I keep. A couple other questions. How do I review x-rays? Just reach out to my office. They can tell you. I don't want it to be an ad. L5-S1 laminectomy 18 months ago. Now fusion 7 months ago. Now diagnosed with spinal foraminal stenosis. Sorry to hear that. Explain the piriformis muscle, please. It's a muscle kind of coming off the butt. It can pinch a nerve. David Ditsworth, non-invasive discectomy, 6 pinholes fixed me out of LA. $35,000 bulge disc. My God. Okay. Well, that's a whole lot of money. Good for that guy. I don't know. I don't do too many cash surgeries because I tell patients you pay enough already for your insurance. Why are you going to pay cash? Sometimes people think paying cash is better, and it's kind of silly. It's like, man, I think surgery is a good example. I paid cash. This guy doesn't take my insurance, so he must be better. It's like, well, I don't know about that. They're probably lower volume, and they probably just don't take cash because they've advertised enough. They don't have to. I don't know, or they don't take insurance. I don't know. I'm not against people that are cash only. I'm not going to go down that rabbit hole, but you pay a lot for your insurance. You might as well use it. Do you do the kyphoplasty procedure? Yep, I do kyphoplasties. Those are good for osteoporotic compression fractures. That's usually, in general, older Caucasian females that have a fracture in the spine. There's certain thresholds and indications, and you could put this balloon in. It's an outpatient little thing, blows it up, and then you backfill it with cement. So I don't love doing kyphos. I'm not trying to be like the kypho king of Dallas, but if a patient needs it, I'm happy to do it. Is there a chance nerve regeneration after cauda equina syndrome? Yes, it depends on how fast you got to the cauda equina syndrome. Have you done a spine jack surgery? I haven't. I'm not 1,000% against spine jack. I don't know. I'm a little anti-spine jack just because kyphoplasties work so well. I don't know. I'm not against spine jack. I'm not the great one to answer on that. Someone's asking if I'm ortho or neuro. I would say I'm ortho because I'm cool. Does foot drop ever go away? It depends how you get to it. Are facet injections bad? No. Do you use navigation? Yes, for certain indications. Maybe larger patients, thoracic spine, certain cervical spine, maybe harder anatomy spine surgeries, not routinely. Not every case, maybe 50-50. I like navigation because it decreases the radiation to my team. and it decreases the radiation to me. And I'm working super hard every day, all day. I don't want to be taken out by thyroid cancer at 60. I'd be really stinking annoyed if that happens. So I like to decrease my radiation. Spine jacks are still considered investigational by the FDA. Oh, I didn't know that. So news to me. Well, I don't use it anyway, so that's good. Looking at a couple other questions. I do have to go. Have you used the Pro Disc replacement? Yep, I use a lot of different disc replacements. This one is a super old one. That's why I have this. It's actually a lumbar disc. The disc replacements that I like the most are, can't get this to go. Here, let's use this. This is a giant model of one. So they're not this big. This is a cervical spine. This is the Simplify one. It used to be Nuvasive, but Nuvasive got bought by Globus. Simplify is a great one. Really, there's not one that's like necessarily better than the others of like the current ones out there. The kind of the big three is Pro Disc is a big one, Simplify is a big one, and Mobi C is a good one and a big one. Mobi C kind of gets a bad reputation, but it really shouldn't. The reason Mobi C gets a bad reputation is because it has maybe the most failures, only because it's like the most prevalent and it's the most common one out there. It'd be like saying, man, I heard there's more Honda Accords that have blown up than Tesla trucks. Well, there's more Honda Accords out there than Tesla trucks are out there, so that kind of makes sense. From Tanya, to answer your question, Rory Mayer. He's a spine surgeon I've worked with, one of my best friends. Rory Mayer like John Mayer. Do I take VA insurance? I don't think I do. I'm not sure. I take a TRICARE, but you'll also have to reach out to my office. Let me go from there. Okay, everyone. So I do have to go here in a minute. Shockingly, and believe it or not, I do have a life outside of jumping on social media on a Saturday night. But my wife was putting our 2-year-old to bed, and so I thought I could sneak out here and do about 20 minutes just kind of into this. From Mac, the answer to your question is Sebastian Rivera. Mac, the answer is Sebastian Rivera. From Alex Ray, will sciatica cause foot coldness and discoloration? It can. That's not too common, honestly. It'd be more pain. There's probably something else going on there. I'd look at more vascular issues, but I really don't want to give it. I can't really even give advice, but I wouldn't really call that. Subjection for pullback. I don't know what that means. Leg numb, back pain, surgery normal. So I just don't know what that means. Can cervical fusions be reversed? They can technically be reversed, but you really shouldn't do that. There's a whole market right now of people like taking out fusions and putting in disc replacements. Bro, that's just crazy. It's stupid also, and it's cash only. So it's just totally dumb. The only time I can kind of get behind it, but I'm like, whatever, is if you do a cervical fusion, it didn't fuse, and they take that out and do a disc replacement. I don't know. I'm like if something didn't go right the first time, how about you do the gold standard and fix it the second time instead of doing something crazy? But I don't want to get canceled by the spine surgery community for going against that. But I think 99% of spine surgeons would agree. You shouldn't reverse a fusion. Just reverse a fusion. Kind of going from there. So look, to answer a couple other questions, if you direct message me, I'll have my staff or myself, they'll send you a template for how to get a hold of me, how to do things. The number one things patients don't do, again, appreciate the likes coming through. That's really helping. The number one things patients don't do is they don't have their x-rays. So you need to go to your spine surgeon and get those on a disc, get those on a CD. You can go to a CVS, believe it or not, and you can upload your images from a CVS. They have this like patient. You'll see this on the top right of my website, Donnelly Spine. You can also send me them just in the mail. That's a very easy way to do it. Or if you have a computer with a CD drive, which nobody does anymore, you can use that computer and upload your images. It's called My Medical Images. I have all the stuff on the top right. It's a blue icon on there. So look, with that, I do promise you I have a life outside of this. I like to jump on here and answer things, but as my family would say, I spend enough time doing spine surgery stuff and patient care and all that stuff anyway. So on my free time on the weekends, who am I to continue to do it? But I like to kind of try to help spine surgeons, give us a little better name, try to educate patients, try to answer questions like what is foraminal stenosis? What is a disc replacement? I'm having surgery. What are some of the risks? I'm happy to answer those questions. And I record my lives, so you can go look at them later if maybe there's a topic I heard. And I appreciate the likes and follows. And with that, have a good night, everybody. I will end this here and talk to y'all.